Well, thank you so much, David, and thank you so much for everyone attending this day here today. To distinguished guests, welcome. Legislative colleagues from across the province, ladies and gentlemen, welcome here this morning, and good morning. What a great day in the life and the history of our province of Saskatchewan. What a special day for this community of North Battleford. And it's a tremendous honor for me to be here with my colleagues today, and it's a tremendous privilege for us to join you this morning as we celebrate what is a landmark achievement in mental health care in our province. The official opening of one of the most advanced mental health treatment centers in all of our nation of Canada, the new Saskatchewan Hospital North Battleford. Ladies and gentlemen, as you can see, driving into this facility, and now that we're in it, this is a remarkable piece of infrastructure. For those who come here for treatment of their mental health challenges, this is a beautiful building, but it's much more than a hospital. It's their home. It's a home that serves as the setting for the honorable and benevolent mission carried out each and every day, as it has been each and every day for over a century now by the staff and the volunteers that come here each and every day. It's an environment that is perfectly suited for the delivery of progressive and humane psychiatric treatment. And today I want to say thank you. I want to say thank you to everyone who had a hand in creating this wonderful environment. I want to say thank you to each and every one of you. You've reached the end of a long road. The process leading up to the opening that we are here to celebrate today of this new, modern, expanded Saskatchewan hospital began so many years ago. And I know that there were many hundreds of people involved along the way. This was a true Saskatchewan team effort. Whether you participated in the patient-first design of the hospital or you took part in the ongoing planning, whether you were engaged in the construction of the building or the planning of clinical support and programs that are being provided, whether you volunteered your time or you helped out with the incredible fundraising effort that surpassed its goal, whether you participated in the nonstop advocacy for this project, like my friend and colleague Herb Cox, always advocating with the previous premier. There was conversations that I saw happening and was privileged to be part of from time to time between Herb and then Premier Brad Wall, between Herb and Don McMorris when he was health minister, and Herb and Dustin Duncan, and Herb and Jim Ryder, and Herb and Greg Ottenbright, and Herb and Chris Tell, and Herb and Randy Weeks, and Herb and every other person that could have an impact on the success of this facility. And to each of you, to all of you that played an important role in bringing the new Saskatchewan Hospital to life, to serve families, not just in North Battleford, but to serve families across the province. And that is why you see colleagues of mine from representing communities across Saskatchewan here today. In doing so, you have earned the gratitude of the entire province. And I want to say thank you. I want to say thank you so very much on behalf of the province. Ladies and gentlemen, most of you are aware that the history of the Saskatchewan Hospital stretches back to the very earliest days of this province of Saskatchewan. And this morning, I can't help but wonder what the first superintendent of the hospital would think if he were here to see this facility. And I'm pretty certain that Dr. James Walter McNeil, I'm pretty certain he would be quite impressed with what he would see here today. I'm pretty certain he would approve. When Dr. McNeil took over the management of the old hospital in 1914, over a century ago, the atmosphere was not what we see here today. It was much more similar to that of a prison, quite frankly. But he changed all of that. In spirit and in fact, actually, is what wrote one historian. He changed all of that in spirit and in fact. The hospital became a place where the patients were treated as human beings in desperate need of help, our help. Dr. McNeil deserved credit for launching the Saskatchewan Hospital on a much more enlightened path. And today, together, we are building on a legacy that he and others have created. The treatment that is offered here to our province's mentally ill in North Battleford has come such a long way. But the physical setting for the provision of that care is another matter entirely. The old building served the province well. It served the province so very well, but it could serve no longer. We had to move on, and today we have. This is our destination, and I'd say that we arrived in a very good place. Ladies and gentlemen, the new Saskatchewan Hospital North Battleford represents the largest single investment ever made in mental health services in the history of the province of Saskatchewan, an investment that we all can be so very proud of. Our government has committed $407 million for the construction of this facility, as well as its ongoing maintenance for the next 30 years. That's a large investment. That's a worthwhile investment. But thanks to the fact that this project went ahead with our partners, our public-private partnership undertaken with Access Prairie Partnership and Graham Construction, we are saving $90 million on behalf of taxpayers, residents of this province. That's $90 million that can continue to be invested in other priorities, including priorities such as mental health care services in Saskatchewan. We think that's very good. We think that's very good for the people of Saskatchewan. In closing, ladies and gentlemen, let me say thank you again on behalf of a very grateful government, on behalf of myself and the colleagues that you see here today and the entire government of Saskatchewan. Let me say thank you on behalf of the people that we serve across the province. And in particular, I want to acknowledge the current and former staff members, the families, and the patients who helped design this facility. Folks, you steered this project in the right direction. And a special thank you to the staff at the hospital who have made the transition to this new facility as smooth and as comfortable for all of the patients involved. This hospital and all of those working here and volunteering here will make a tremendous difference in the lives of so many families, hundreds of families, in the years to come. And that's worth celebrating. That's worth celebrating today, and that's worth celebrating every day. Thank you again so much for coming to celebrate this investment.